Hi everyone, we are the CrazyCoders and our project is on the detection of SARS-CoV-2 infections from lung CT images. The problem we identified is that COVID-19 is a dangerously infectious disease and current tests exist but take a long time to receive results and are often inaccurate. Despite negative PCR tests, CT scans of lungs have accurately identified positive COVID-19 cases. Our aim is a faster, more reliable method to determine if a person is infected with COVID-19 and the severity per individual. Lungs appear opaque on a CT image if infected, so our program will analyze CT scans comparing opacity of healthy and infected lungs to determine infection status with an immediate confirmation or denial statement result. A few code intangibles we identified are that the code relies on the user downloading the .rer files from the Harvard Dataverse data source. Once the .rer file is downloaded, the Express zip file compression application was used to extract DICOM images and files for analysis. The pathway is the folder where the DICOM images are found. When the code finishes running, the user might want to save the prevalence matrix variable as a .mat file.
Now it is time to look at the demo within MATLAB. So for our code, the first thing that it requests of the user is the DICOM image folder. You can find this by going to this spot within the window and copy and pasting this file or this folder pathway. Once you copy and paste it within the command window, it'll prompt a question about which subject the data corresponds to. Once the subject has been established, it will run through a for loop, which scans through every single DICOM or common file name within the DICOM image folder and output a prevalence matrix that corresponds with each one of the files. Once the prevalence matrix has been compiled, the mean prevalence, the standard deviation, and then also the prevalence variance will be output within the command window. The table and cell array, which records the mean prevalence, the standard deviation, and also the prevalence variance, are exported through a data file and then also a text file, which you can see at the bottom of the current folder. From here, it prompts a question asking which threshold would you like to correlate your results with. For this example, I chose variance. And based on the variance value that corresponds with subject 51 in comparison to the variance threshold established with the first 50 subjects, it can be concluded that this patient has tested positive for the SARS-CoV-2 infection.
So here are 3 images from an infected patient and 3 more images from a normal healthy patient. So as mentioned, COVID positive patients have much more opacity in the lungs. An example of this can be seen in the top left image at the bottom of the right lung cavity. There's opacity that is not seen in its counterpart in the bottom left. And this trend continues throughout all the images and all the subjects. So as John mentioned, our code has 2 outputs to analyze, which are the mean prevalence and the prevalence variance. So for the mean prevalence, out of 50 subjects, our program processed 43 subjects correctly, leaving us with a 86% efficiency. And for the 20 control subjects, it was 100% efficient. As far as the prevalence variance, out of 50 subjects, we processed 48 correctly, leaving us with 96% efficiency. And again, the percent efficiency for the control data was 100%. This leads us to conclude in diagnosing patients for COVID-19, the prevalence variance is better than the mean prevalence or effectiveness.
For the conclusion, first, some of the pros of our program. Upon receiving a CT scan, it offers an immediate result which reduces the risk of transmission and the delay of treatment. It also has a more accurate detection rate than the current detection tests, and it has an easy to follow intuitive interface. Now, some of the cons. The program requires a patient to go get a CT scan, which is more time consuming and expensive. And our program requires a data extraction tool to retrieve positive scans from a .rer file. That is the end of our presentation, and we thank you for listening.